Good evening. My name is Kashif Fakhruddin. I'm the president of Islamic Center of Naperville. Tonight we have arranged a program on the corona awareness. There are a lot of anxiety questions in the community, so we thought to offer a program that will address and answer questions to that a lot of community members have. So with that, I would like to invite Dr. Atif. Dr. Atif Fakhruddin, he will go through and introduce the topic and the program. Dr. Atif?
Yeah. Assalamu alaikum warahmatullahi wabarakatuh. Peace and blessings be upon to everybody. My name is Dr. Atif Fakhruddin. I am a practicing physician in the community. I also volunteer for ICN Free Clinic here. I want to begin with a disclaimer for this program and to all the audience that whatever information that we have for you tonight, it might get modified or changed tomorrow. The way this disease is evolving, we have new guidelines coming frequently in an hourly basis. So that's just a disclaimer I want to start with. Reason really we're seeing so much confusion, and we understand totally why we're so confused. A disease starts in China, spreads in China, then across continent, USA, Europe, everywhere. Some stores are closing, schools are closing, some are not closing. It is causing chaos and confusion. So the purpose really here is that we do realize there's a lot of fear of unknown here, and inshallah we'll try to do our best so you understand the disease, and the purpose of this program is make you aware and just to address the fear of unknown. And for that, I'm going to introduce my partner, Dr. Usman Khan, to carry on with the program, and I'll come back for the second part.
Assalamu alaikum everyone, peace be upon you, and welcome and thank you very much to join us tonight for this program. As I would like to introduce myself, of course. I'm Dr. Usman, another volunteer at ICN Free Clinic and a community physician. So basically, as Dr. Atif mentioned, the purpose of this presentation is to talk about this situation, this condition that has gripped us for the last few days so badly that we are experiencing a frenzy of irrational things and behavior in our community and the community at large. There has been a tremendous amount of anxiety and fear and concerns regarding this virus. And a lot of that is because of fear of unknown, as was alluded before. Psychologists basically mention why an irrational fear occurs in human beings is because they have a desire of knowledge, understanding, and certainty. They want to understand about any process, why is it happening, and they want some sort of certainty. They don't like the uncertain situations. And they also have a desire of control and safety. Once they are provided with once these two desires are fulfilled, accomplished, the fear subsides, or at least become rational. And that's what we are trying to do here tonight. We by no means are trying to downplay the intensity of this situation. There is no doubt that this has been a pandemic. In last several decades, we haven't seen this, but we still have to accomplish those two targets that I mentioned. Understanding, having the knowledge, having some certainty, and having control and sense of security. So we plan to present some scientific data that we know so far And as a believing community, a faith-based community, I would also present a perspective that as a believer, what should be how are we supposed to react in such situations to attain those two factors. So as I mentioned, in our faith teaches us in every situation how we are supposed to react in any condition. And I have just quoted here one of the verse from Holy Quran in chapter 9, verse 51, which can be translated as, say that any calamity that befalls us is nothing but what Allah or the Almighty God has decreed. And He is our sustainer, and upon Him the believers trust. It gives us a strength, as I said, the desire of having control and security, that we believe that our God, our protector, is with us, and He will control the situation and provide us the security. And then we have a supplication that we can recite to gain that sense of security that our Prophet has taught us in such situation. Bismillahillazi la yadurru ma'asmihi shay'un fil ardi wa la fis samai wa huwa as-sami'ul alim. Meaning that there is nothing in the earth or in the heavens that can harm us without Allah's permission, and He is the one who listens and knows everything. So that was just I just wanted to touch upon as a believer, because if we do not behave as a believer, it's not demanded of us. Moving on to the next slide. Okay, so just wanted to share some basic facts about the virus. The coronavirus is basically, it's not a new virus. It's a very old virus. Actually, the virus was initially discovered in 1960. And it belongs to a big family of viruses called corona. And there are several strains that have been discovered from this family. And some of them I will mention later on, but the virus that we're talking about is SARS-CoV-2 is the scientific or medical name, severe acute respiratory syndrome, coronavirus 2. And it's called virus 2 because virus 1 was actually diagnosed and first discovered in 2002, which caused an epidemic of SARS. And then, as I mentioned, this whole family of viruses was diagnosed in 1960, and it has been present and has caused infections in human beings, most commonly causing common colds that everyone gets sick with. It is also coronavirus, caused by one of the coronavirus. It also has caused SARS, which was a severe illness that was first diagnosed in 2002 and 3. Then in 2006, we had another strain of virus from this family which caused Middle Eastern respiratory syndrome, MERS, and then now we have COVID-19. So these three strains have caused a significant morbidity or illness in human beings, but there are several others which have called mild illnesses, and we don't talk about that. So there is a chart that just basically tells you how this virus is transmitted to the men. So as I mentioned, there are several other strains that I am not mentioning here. I'm just depicting here only 3 viruses that have caused very severe illnesses in human beings. And we have found that the source or the host of this virus is the bat. The virus is carried by the bat, and somehow it gets transmitted to the human being, and when it happens, it causes severe illness. So in 2002, this virus from the host transmitted to human beings through an intermediate host, which was a civet cat, and that resulted in severe acute respiratory syndrome. In 2006, another strain, MERS, was transmitted from the host bat through the camel, which was the intermediate host, to the human being again, resulting in Middle Eastern respiratory syndrome, which was also a very fatal illness. And now, in 2019, December, we had coronavirus, CoV-2, which is causing COVID-19 disease. We do not know what's the intermediate host. We do not know at this point what caused the transmission from the bat to the human being. This is the current status of the coronavirus in the United States. This is a tracker that is actively being updated on a daily basis. And as you can see, there are total 1,268 confirmed cases of coronavirus in the US. And these are the states that have that have patients which died with this infection. And the most badly hit state is Washington. As you can see, the biggest circle here in the Washington. The next slide would focus on the Illinois.
We have to turn the light off. For clear picture.
So, in our state of Illinois, basically, so far there are confirmed, actually this is not updated slide, but the confirmed cases are 42 now, with 0 deaths, and 2 patients have recovered. With this, you can calculate the mortality of this virus, which is roughly around between 2 and 3% at this point. Next slide. So at this table, what we're trying to tell you is that, as I mentioned in the beginning, trying to allay some anxiety that is prevailing high. So you need to know where COVID-19 virus stands when it is compared with other coronaviruses infections that have happened in the past. So as I mentioned, SARS, which actually I treated myself in 2002, I was a resident, and we had patients of SARS in our hospital. That had a mortality of about a little bit higher than 10%, and MERS, which appeared in 2006, had a significantly higher mortality at 36%. COVID-19, on the other hand, has a mortality of about 3% at this point, 1.5 to 3% depending on the age. Yes, it is spreading very fast compared to MERS and SARS, and that's what's making this virus very horrific and very scary. But the reason for that is that it's easy transmissibility. Longer incubation period of the virus allows asymptomatic patients to transmit this virus to others before they get sick, and that's why the virus is spreading much more fast at a faster pace compared to MERS and SARS. But you can see that we had a swine flu or bird flu with a 60% mortality. We have Ebola with 50%, and we had in 2018 we had a H1N1 flu. So we have been through these infections in the past, and we have dealt with those. And with the proper precautions, we can deal with this situation again one more time. But we need to put the things in the right perspective. The other thing you need to know is that everybody just thinks that COVID-19 is going to cause death in everyone. That is not the case. You have to see what is the result, what is the spectrum of the illness. If you do get infected, almost 81% patients have a mild flu-like symptoms, which passes in 1 to 2 weeks, and you just need to stay at home. Severe hospitalization is up to 14%, and only 4.7 or up to 5% is resulting in critical illness, which requires ICU stay or maybe ventilation. So majority of patients who are getting sick are going to recover. So, and what are the patients who are getting critically ill? Those are patients who are elderly. As you can see, the highest mortality rate is in 80+ age people. So the mortality significantly increases after age 60. It is not fatal in the infants at all, 0% mortality, and a very low level illness in children to middle-aged people. So one thing to understand and reassure you, everyone, that the illness is present, but it is not going to cause death in everyone. So what are those people who are having this more severe illness? As we said, age is one factor, and then having pre-existing So having pre-existing condition is a significant factor in causing critical illness. If you are already sick with a cardiovascular disease,
Wrong with the PowerPoint here. All right.
is it good?
Yeah.
So if you already have a cardiovascular disease, diabetes, any respiratory illness, cancer, anything that makes you immunocompromised would significantly increase the chances of a critical illness and increase the chances of death. However, people who do have no existing condition, you can see here that the mortality rate is very low in such patients.
Next one.
Next slide. So this was the basically current scientific knowledge, fact-based knowledge that we have so far about the current status of coronavirus. I hope some of these facts has helped you to allay the anxiety. We also need to understand to cope better. As I said, we do need to take necessary precautions. And in order to take the necessary precautions, we have to understand what we can do, why the virus is spreading. So this, before I mention transmission from the host to human, This is a person-to-person transmission, which is called community transmission. That is unfortunately happening in the United States now. So there are cases being diagnosed or detected at this point who have not traveled to China or any other international travel, and they have not been exposed to anybody who traveled, but they are being diagnosed with the infection. And how is that happening, or why is that happening? Coronavirus has a droplet transmission. What is droplet transmission? Is basically when you cough or sneeze, the virus is in the droplet spray, the spray that comes out of your mouth, and based on the virus size and the weight, they are going to deposit, and the coronavirus is going to deposit within a radius of 6 feet. As you can see, some of the bugs here, bacteria and viruses, as TB, measles, and other viruses, these are airborne. And airborne means you can transmit through air current. This, so far, we know that this is being transmitted through the droplet, which means it is deposited on the surface, and then it can stay on those surfaces up to 2 to 24 hours, depending on what kind of surface is that. And if someone touches that surface and then touches their eye, nose, mouth, they can transmit the infection to themselves. So that is called fomite transmission. Next slide. Okay, so the common signs and symptoms if you get infected, as I mentioned, the latent phase of this virus is 2 to 14 days, meaning you can start showing the symptoms within 2 days up to 14 days. And this is the asymptomatic time period when you can transmit the infection to others. Common symptoms and signs that are mentioned in patients are fever of 100.4 degree Fahrenheit, dry cough, shortness of breath, malaise or weakness, and less common abdominal pain, vomiting, and diarrhea. So this was a background of the virus, what we know about and what we can do. I'm going to invite Dr. Atif again, and he is just advise us what we can do about with the situation that is prevailing among us.
Thank you, Sman. Of course, he's the intellect part of the talk, and here I am to talk about non-intellect, easy part. So I get the easy job, he did the difficult part. So of course, we've learned so far what the virus is, how it presents, things like that. Now my job is going to be, how do we know we have it, and we'll go on from there. So next slide, please. So far, how do we diagnose coronavirus? At this point in time, we're using a technique called nasal and oropharyngeal swab. If you look at the picture here, they take a swab, they go up your nose, they take some they just scrub the inside of the nose wall, and they also do the same procedure through your mouth as well. So that's the most common method. Other is we ask you to bring your sputum, so they do that, and then all these tests right now are getting performed at state level at the CDC department. Of course, as we all know, it's changing, evolving so rapidly. They're trying to have more and more places do it. So as time goes by, maybe by Monday, Tuesday, we'll have more centers, but that's the procedure of diagnosing the test. Next slide. So once it's diagnosed, how do we treat? So I will say, you see this in bold here, the best treatment so far is self-quarantine. That is the treatment at this point in time of the virus itself. Of course, it can have complications that will be dealt differently, but the COVID-19, the treatment is self-quarantine. People ask us, what's Tamiflu? We have no idea if it's, so far, it's not effective. Kaletra, other medicine, it might shorten the course, but it's not indicated, and so, again, treatment is self-quarantine. Next slide. So, that is the biggest thing that as physicians, we hear this and we understand, I would be concerned as myself, that what if I'm infected? So, problem with this virus, it presents like any other flu-like illness. So there's no one symptom that will say you have COVID-19. So typical symptoms are, as was mentioned earlier, fever, cough, malaise. Just imagine it's seen in everywhere. So we really cannot test at this point in time if you have these three symptoms. So as of today until 4 p.m., the recommendation was, if you have these three symptoms, you're just going to stay home, try to limit contact with someone else. So, and you hope it wasn't COVID-19, which probably most likely it won't be, and it'll pass. Exception to the rule here is this, that unless you have high risk exposure, you went to China, Iran, Italy, or you've been exposed to a true COVID-19 person, that's when you pick up the phone, you call your primary care doctor. We have instructions at that point in time. There's a hotline. All of us are calling the hotline. Even physicians are told to call this number. From there, when you call this number, they fax us a form. We provide information. Then they give us directions where you need to go. So that's one. Other case scenario is this: if you have high-grade fever for a few days and you're short of breath, that's when you go to emergency room. That's a recommendation at this point in time. Again, I said earlier, it's changing, but so far this was true about until this afternoon. Next slide, please. So other thing is, what if my family member has it? These are things that are common scenario. It can happen to anybody. At this time, like 2 weeks ago, we didn't think much about it because, we weren't too sure. Now it's hitting home. So what if my family member has it? The best way is really, you should make sure there's no contact. So the household members should stay in other rooms. We shouldn't allow visitors. Hand hygiene frequently. I'll come to that in a second. Mask for the patient. We need to make sure we wipe all the high-touch surfaces frequently using alcohol-based wipes. Next slide. So remember when I said self-quarantine, really, so this all pertains to that. So what we do is this, it's really all common sense thing that we all need to do and we can do. We need to stay in a room, we are not going to share personal items, and we need to wear a mask. If you are suspected and you're in quarantine, you need to be in isolation. Personal items, glass, utensils, we shouldn't be sharing, and we need to put on a mask ourselves. I touched on hand washing. So recommendation is with soap and water for 20 seconds. Studies were done, when we wash our hands, it's about every 5 to 7 seconds. So we have to almost, add it about 3 more times. It does take longer, try to do it, but it's a must. That's a must thing that we must do. Wash your hands with soap and water at least 20 seconds. Of course, we need to cover a sneeze and cough. The best way is, especially this day and age, we used to say, you can elbow your cough, but no longer. You need to carry a tissue or napkin with you, and then once you use it, just dispose in the garbage bin. We need to wipe down the common touch surfaces. Of course, common stuff, your desk, your laptop, the doorknobs, elevator buttons, things that we touch commonly. So we need to make sure we wipe them multiple times. No handshaking. It is becoming very important. We must follow that. We can elbow if we absolutely have to, but no physical contact. This virus, as of now, is through droplet. That means through contact, it gets spread to one another. Next slide. To be honest with you, this is the most important slide of the presentation. This is the take-home slide. And there is so much panic that out of panic and fear, we're starting to not do and do not what we can easily do. So, a lot of illnesses, diabetes, high blood pressure, there's so much needs to be done. But so far, this viral illness, there are only 7 to 9 things one can do. So please pay attention, focus here. If you can take a picture, maybe we'll send the presentation to you, or it's online almost everywhere. These are common points. You need to probably memorize them now if you haven't done it already. So what are the do's? Wash hands frequently. One item, if you need to remember, should remember all, but this is the most important, to wash your hands frequently. We need to cover a cough and sneeze. Frequently wipe high touch, common touch surfaces. We need to keep a distance of at least, 6 feet from someone who you think could be coughing, sneezing, or who looks ill. So minimum distance is 6 feet. We need to, wipe the surfaces, cover our nose when we cough and sneeze, and wash them frequently. And then when we need to hand sanitizers are almost every place in business. Keep it at home. Alcohol-based hand sanitizer, 60% minimum requirement. So we should all have it. Now at the time the stores weren't having it. I think they're restocking them now. So please buy those. What are the don'ts? So most important right now is do not panic. We understand the confusion, lack of certainty, and there's a lot of panic and hysteria. That does not help the situation. So please do not panic. One more thing which is very important. Common cold is caused by coronavirus. So when we go with an illness, when they do a nasal swab, you might get a phone call, you have coronavirus. Coronavirus can cause common cold. It is not COVID-19. So please remember, if you heard the word, somebody's corona, if it's not COVID-19, it's a common cold virus. So people are getting really nervous about this. So just remember, not every cold is going to be COVID-19. As of today and right now, masks are not recommended for general population. But for healthcare providers or someone who's taking care of COVID-19 patient, they need to put on masks. But for general population, as of today, mask was not recommended. Of course, large gatherings, we need to avoid those. If there's a birthday party, function, celebration, large gatherings, you should try to do your best to not attend those, because again, the purpose is to minimize contact with large gatherings where there might be someone carrying the infection. Initially, we thought that COVID-19 would only spread when someone's coughing, and so that's changed now. Even a carrier, that means you have the virus in your nose or throat, you may not have any symptoms, you can still pass on the infection. So that's why it's best to avoid large gatherings. Of course, sick contacts, that's common sense as well. Unnecessary travel. If you're going for leisure, at this time, recommendations do not go. Of course, if you have a job interview, you can't get away without it, then you have to go. Just make sure, take the sanitizer with you, take the wipes with you. Any common surface area, just wipe and just take precautions. One last thing on this is, please, I request to everybody who's listening in the entire community, do not forward unverified information on social media. It's adding to the panic and hysteria. There's so much stuff out there. Some 20 years old, some 30 years old. It's present as it's happening now. So if it's not verified, please do not share. There's so much panic when people are sending pictures of stores, long lines and stuff. It caused fear in us. What's going on? There's nothing for me to eat. My child would die of starvation. It's not at this point as of yet. So please, it's good to be prepared, but I think at this point it's adding more hysteria. So, now Usman and I will take questions, and I just want to close off here is, thank you for your time. I know that in the beginning the camera was shaking a little and the voice wasn't too good. So apologies for that. Hopefully it's good now. So I hope with this we try to empower you as to what you can do. I understand there's a lot of stuff now that we don't know, but what we know is easily applicable. Just remember the do's and don'ts, and please apply. Rest we don't know. Best example is this. Just think of a weatherman telling us that a big blizzard is coming or has come. Sometimes they're wrong. We want this situation when they're totally wrong. But what if they're right? We have to be prepared that they are right. And that's what's being done right now. So we don't need to panic. We don't need to be hysterical about this. As faith-based community, we know if it's going to happen from a creator, it's going to happen. On the same token, we need to have the knowledge. What can we do? And hopefully with this talk, Usman and I try to give that to you, and you'll be able to implement and just help one another and pray. With this, we'll open the floor. We'll take questions. So we have someone here, and then I think you understand that you can send by WebEx or through Facebook. So we have a question. Okay.
Don't see any questions here. Let's see. Folks can send questions through the chat window.
So we have a question here from yes.
Yeah, my question is, you said that the mortality rate is about 2 to 3%. but this virus is spreading much faster than any of the other ones, SARS and Middle Eastern flu. So do you think, the total mortality rate on this one will, because of its spreading and it's so contagious, is going to exceed the other viruses in the past?
So that is one. As
Please
you
repeat
said,
the question.
The question that was asked is that at this point, the mortality that has been calculated is much lower than the mortality for SARS or MERS. COVID-19 mortality is only up to 3% as opposed to SARS, which was about 10%, and MERS was up to 35%. And the question was, can it exceed those two previous viruses? It is an evolving situation. It may exceed, but so far what we know, the way virus is behaving, and we have a big cohort to predict. A large number of mainland China was infected, followed by Iran and Italy, and that has shown a recovery already. So we have decent amount of data to predict that its mortality is going to stay lower than SARS or MERS. One point I wanted to add is that transmissibility is that what's scaring everyone, because it has higher transmissibility rate, which is causing illness in a wider population compared to those two, because they were so fatal or lethal viruses that they used to kill people before they could transmit to others. And the other factor is their incubation period of this virus is longer, so you can transmit the virus to others before showing the signs and symptoms. But I do want to emphasize on this point is that the transmissibility of, or the contagious state of this virus is most when you are symptomatic. Yes, you can transmit the virus to others while you are asymptomatic in prodromal phase, but it is less likely as opposed to when you're symptomatic. So that is a big reassuring thing. People should understand that people are not walking in the community transmitting this virus right and left. That's not happening. It can happen to some extent, but it's not happening. It is when one becomes infected and starts showing signs, sneezing and coughing, that's what they're transmitting the virus mostly.
The travels were not banned then, and the schools were not closed then, so the transmissibility is the reason it is so fast. That's why all the travel has been banned and schools have been closed.
Right, so these are the containment procedure. They are trying to contain the virus so that it does not spread at a fast pace.
Okay, so there is a request from a community member to share the presentation slides with the community, or at least the hotline number.
Okay, we will.
Okay, and then the next question, please ask how someone quarantine themselves from their families if they are exposed, if they are PUI, patient under investigation, or should they or only quarantine from friends, family, not living at home?
So the question is, how does one quarantine themselves if they're in contact with someone?
Yeah, quarantine themselves from their families if they are exposed.
So we had a slide here, maybe if we can go back, so we'll put it up again. We went through that, but it's good to go over one more time.
Which one?
So, I think yeah, you can do this. That's fine. So really the best way to do it is this. If you are trying to protect, I think the best way is you need to stay in a room by yourself. Do not share your personal items with anyone else. You need to wear a mask. We need to minimize contact, so no more guests coming. And I think if you follow these three, on top of that, make sure you wash your hands multiple times. Maybe 10 times a day, and wipe all the commonly touched surfaces. That's the best you can do in terms of quarantine. Again, just keep yourself within a room. No one should come inside your room unless they have to. If someone comes in, you have to be masked. Wash your hands, commonly surface, again, wipe them many times, and hopefully it should help not spread the virus. And up to 14 days. Right now, the recommendation up to 14 days, 2 weeks.
Next question. Flu season ends by April. Will COVID-19 subside by then?
We can't tell this with surety, as again, this is an evolving situation, changing every day, and it's a new mutation, new mutant virus. We don't know about this virus. We can compare its behavior from its siblings. SARS COVID virus 2, SARS-2 virus is behaving very much similar to SARS-1 in many ways and in many aspects. And that is why we believe that it should subside when the season changes. Whether it will, at CDC website, we do not have that information, whether this virus will be killed by hotter temperature or disappear in summer. It may or it may not happen.
Another question. Does zinc pills help cure or contain the COVID-19 virus? Zinc.
Zinc.
So, no, we don't know this point in time. So, you might have seen a lot of recommendations that you need to eat zinc, iron units, vitamin C, water. Those are general measures that are recommended for patients for any viral illness. There is no known sort of effect that we know of zinc during this virus. So, no.
Okay. Next question. Are there any type of foods or vitamins to boost immunity against the virus?
So, recommendation is vitamin C, vitamin D, and drink plenty of fluids. And the rationale of fluids, as I say, is this, that we know this virus stays in your nose and throat. So when you drink water multiple times, it washes your saliva and the secretion from your throat into your stomach. So that's the rationale of drinking fluids. So, and that holds true for any viral illness as well.
Any other questions?
No, there are no questions on the WebEx.
So I think if there are no questions, I want to thank everybody for your time. Thanks for listening. Hopefully it was helpful. And those who know us, those who know ICN, they can post questions. I guess there's one more.
There's one more question. This one is actually, I have heard Tamiflu has shown to be effective against COVID-19. Is there any over-the-counter drug comparable to Tamiflu?
No, Tamiflu has not been shown to be effective against COVID-19. That is a fallacy. Again, this is what's going on in social media. People are forwarding unverified information. Tamiflu is not even a treatment for seasonal influenza. It does not cure the infection. It shortens the course of infection in influenza, and it has no role in COVID-19 so far. At this point, as Dr. Atif mentioned, there is no treatment of COVID-19 except frequent hand washing and self-isolation if you have been diagnosed with it. There is nothing else you can do.
One more question.
Yeah, I have a question about the testing. Looks like there's no testing available whatsoever. Generally, and also, can you shed some light on the vaccine that I heard is not going to be developed in like a year and a half?
So the first question is about the testing. So testing has been available. It was limited and restricted. To give you an idea perspective, the hospital called Rush Copy in Aurora, until 2 days ago, they only ran 4 tests. So they were very limited as to how many they can do. Otherwise, we're getting phone calls, everybody walking in, I have coronavirus. So we were really restricting as to who, with following strict guidance, so test was there, but very limited. But after Donald Trump's speech today with national emergency, we've been told that by Tuesday, it will be readily available. They are going to be very flexible with who we test. So they will be testing a lot more, I think, starting Tuesday, next, coming week. So that's that. And your second question was vaccine. Typically the way vaccines work is for live viruses, they inject the live virus into either a rabbit, rat, or a horse. And then they make antibodies, then they extract that, and that's used. Of course, I said this in 30 seconds. in reality, 2, 3, 5, 6 years it can take to develop a vaccine. You're right. So far, I think the best guesstimate is 2021 early we'll have a vaccine. Of course, with being a national emergency, a lot of funds is getting pumped towards this. We hope and pray it'll change. But again, as of earlier today, vaccine is going to be 2021 March, April time.
One more question. Will you have testing available at your free clinic at any time soon?
I don't think I can answer that question at this point in time. It all depends. We hope and pray that we can curtail and control it. But if it gets out of control, that they're going to have multiple access points, things like that it might. But at this point in time, I don't foresee that.
So the issue is the kit is not available, or it's so expensive, or what's wrong with testing more? Is it?
I think what we were told that we had limited kits. So again, Roche will be making a lot more.
Uh-huh.
In fact, Donald Trump announced in his speech today that they've contacted Roche, and Roche said they will come up with, maybe hundreds of thousands of kits by Monday, Tuesday. So I think if we had said around 9:45, we're almost there. So I do want to thank ICN for allowing us to do this for the community. And again, the main purpose was for you to be aware and do your part, which is, I had a slide with you, you'll have it, inshallah. And then please do not panic. And those who know us, you can reach out to us. Those who don't, reach out to us in platform. And so thank you so much, and Dr. Swan.
Thank you all who joined us tonight, and I hope this was helpful and we were to some degree successful in removing some of the concerns and the anxiety among the community members. And who joined and learned something, I request them to forward this information to their family members and friends so that some sense prevails on social media. This is my message. And we have this available for another session if requested.